This segment is brought to you by Central National Bank. Put our ag professionals to work for you.
Good morning and welcome to Farm Factor on Ag Am in Kansas. I'm your host, Conrad Cabas. The Kansas Soybean Expo was held January 7th in Topeka, Kansas. Many farmers and industry partners attended. Take a look. The Kansas Soybean Expo has a diverse role in farmers' operations and presents many opportunities, some from a research standpoint. Participants were able to attend 2 of 3 K-State Research and Extension breakout sessions. Doug Jardine, PhD plant pathologist, presented Sudden Death Syndrome, SDS 101, Identification and Management.
Well, today at the Soybean Expo, I'm going to be talking about a particular soybean disease known as soybean sudden death syndrome. It's been in Kansas since the mid-1990s, but the last 2 years there's been a significant increase not only in the severity of the disease, but in where we're finding it in Kansas. And so there's a lot of producers who suffered some significant loss to the disease in the last couple of years, so we're going to be here today talking to them about how do you identify it, because there are some other things that look similar to it, and then what are some of the things that they can do to manage it.
The disease has affected some of the research farms from Kansas State, and this infection will help researchers provide information to producers.
Well, from a research standpoint, we have an advantage that we have a couple of our K-State research farms that do have the disease on it, so that makes it kind of easy to look at things. On those farms, we're doing a lot with our soybean breeder, looking for resistance, because in the long run, that's the best way to deal with the disease. But there are also some new chemical seed treatment products that are coming on market, and so over the last couple of years, we've had a chance to evaluate those. And in fact, they look very promising, and that's one of the things that we'll be talking about with producers today, is about this new product that will be coming on the market in 2015 that specifically for fields that they have had the problem in, they may want to take a look at this as a management approach.
SDS is a very slow-growing fungus and takes a considerable amount of time to appear. While symptoms usually appear in mid to late August, SDS usually affects the soybean plant quite early in the season, usually in early May.
Well, of course, their main concern is, sometimes what is it? Because there are some diseases that have very similar symptoms. And so, again, one of the things we'll talk about today is how do you identify those different diseases, separate them from each other so that you are in fact dealing with sudden death syndrome. And of course, there are other questions always is what can we do about it? And again, the second part of the program today will be aimed at management. We'll talk about what weather conditions favor the disease, and then again, some of the things that they can do with variety selection, perhaps crop rotation, and management with chemicals. And the other thing is this disease almost always occurs in fields that already have soybean cyst nematode in. And so part of the management program is managing the soybean cyst nematode as well as the sudden death syndrome.
SDS is also sometimes mistaken for brown stem rot. Yield losses vary according to severity, but reports of 20% loss or greater is not uncommon.
Well, this disease, interestingly enough, among plant pathologists is sometimes referred to as the good grower disease. It seems to occur in the most highly managed fields where you have good fertility, you're using irrigation, you're doing all the little things that you think will get you the best yield. And we're not sure why, but when we get rain during the grain field period, this tends to trigger the disease, and then we end up with some significant yield losses. So as we look at weather factors that are involved, typically it's wet early in the season, and then again wet during the grain filling period of time seem to be most favorable.
Hey folks, Dr. Dan from Doc Talk. If you miss us on Monday morning, you can join us at 6:30 a.m. every Sunday morning on RFD TV. Doc Talk has a national following. We're sure glad that you joined us on Mondays, but if you miss us and you want to catch us out on a Sunday morning, get up at 6:30 a.m. and we'll be right there, RFD TV, 6:30 a.m. Central Standard Time, and I'll see you down the road.